combining all these three factors or these three things, we should not be surprised that in hospitals, possibility for acquiring infections is still existing. So, from Centers of Disease Control and Prevention, we have here some statistics, all right, on the existence of nosocomial infections. 40% of nosocomial infections are urinary tract infections. Next to it, we have surgical site infections, 20%. LRTIs, lower tract respiratory infections, go in third. Bacteremia by means of IV catheterizations go next, or is in the fourth place at 6%. Skin infections at 8%, and others unrecorded, or other unrecorded types, or other not not so major types of infections at 11%. Right, so these are common microbes that we can see causing nosocomial infections. Coagulase negative staphylococci, Staphylococcus aureus, Enterococcus, gram negative rods, and Clostridium difficile. What's alarming about microbial infections, or microbes that are capable of causing hospital acquired infections, is they share a very similar, or a very alarming trait with one another, and that is their resistance to antimicrobials. Okay, very good example, or a very popular example of a nosocomial infectious agent is MRSA, methicillin resistant Staphylococcus aureus, which is a common cutaneous a common infection that can cause cutaneous diseases to newborns. Okay, scalding disease for newborns if the mother contracts MRSA and transports, or trans or what do you call this, transfers the pathogen to the baby or the newborn. No. Some procedures in the hospitals are said to be contributory to the likelihood of acquiring the infection. Some of these procedures include hemodialysis, IV catheterization. Obviously, surgery is is a procedure that will increase the acquisition of microbial pathogens from the hospital environment. Catheters, urinary bladder catheters, and ventilators. No, the attachment of a respirator to a patient is capable of causing infection, no, microbial infections. How do we control nosocomial infections? The hospital is still the best place to be in, especially if your disease should really be uh, uh, given treatment by medical doctors, by specialists. So there's no reason to stay away from hospital, even though we can acquire hospital acquired infections from them. We control nosocomial infections by means of aseptic techniques, variety of aseptic techniques that include hand washing, and the use of disinfectants, appropriate disinfectants, and biocides, and of course protocols when it comes to taking care of the patient, including transmission of the patient from one unit to another, the tending to the needs of the patient, giving the patient a bath, or feeding the patient. So those protocols should be followed in order to prevent contact, or transmission of the pathogen from one host to another.